Well. Good evening, everyone. Good evening, everyone. This is another edition of Ask Dr. Afflalo. I'm going to step out of the way because the doc is here herself. Dr. Afflalo, happy, what we say, Happy New Year, happy Black History Month, and happy preparing for a colon month in in
March.
March.
Yes,
Yes.
absolutely. Well, thank you for having me. I appreciate it. And good afternoon, everyone, or good evening. Yes, so March is Colon Cancer Awareness Month. And so we want to focus today a little bit on actually the entire GI tract, starting from the mouth, going all the way to the end of the road.
Okay, so the GI tract is from the mouth, from entrance to exit.
Exactly.
Okay. All
All
right.
right.
Somebody gonna say, well, what you trying to say? From entrance to exit. Don't try to add nothing else into it.
That sounds perfect. So we'll just start off with some basic things about, oral health in terms of the mouth and the throat. Oral health, making sure you do good dental hygiene, things like that. Because believe it or not, if you don't do that, then you can have a lot of issues in terms of infections in your mouth, which affects other parts of your body. So if you have issues with dental infections, you will have problems with delayed for surgeries, and if you have some kind of a prosthetic, say joint, you can run the risk of actually having that infected. So good oral hygiene is important. Then we move down to the
Well, can we stop there? Because what does good oral hygiene look like? Because, say for instance, I brush twice a day. I'm forever flossing. But a lot of times I don't really believe that we have been taught how to brush correctly. What is this whole thing about brushing the top and the bottom of your tongue? And, tell us what's some of the things that we should look at when we're thinking about the oral hygiene of our mouth.
So gums are important. So the teeth, if the gums are not healthy, then the teeth won't actually stay in the gums, and that's when you get loose teeth and they'll fall out. But if you don't take care of the gums, you can have gingivitis and things like that, where you'll have overgrowth of the gums. They'll bleed. They can get infections down into the cavity areas. But it is brushing twice a day or more if you want to, but flossing so that the food and the bacteria don't get stuck in between the teeth and start causing infection. So if you see anything, you should brush your tongue too, because it has a lot of bacteria on it. Taste buds are to the back. But what you want to do is make sure that you look in the mouth and make sure there isn't any lesions or ulcers or something that looks suspicious on the hard palate, which is the roof of your mouth, and the soft palate, which is on the back. Still the roof of the mouth, but then the back, when you touch your tongue back there, it's softer. Sometimes there'll be a bump there or a sore or discoloration, and you want to bring that to your dentist, the attention of your dentist. And if they don't really know what it is, then we need to send you to an oral surgeon or a head and neck person to evaluate that. Sometimes you definitely can get oral cancer, especially for people that smoke and things like that. So that's the mouth, and that's very important to make sure you have good oral hygiene.
So basically, if you have a friend or somebody that has halitosis, they need to check their oral hygiene to make sure that there's no infections or things that happen. That halitosis or bad breath sometimes is a sign of that there's something going on in your GI tract of the mouth.
Yeah, and it can be the mouth. It can actually even be coming from the stomach.
Okay.
So that's why they need to evaluate. If they do everything, brush, floss, gargle, and everything, and still have bad breath, they need to look at a source. It could be sinuses draining into their oral cavity, or it could be coming from the upper part of the esophagus or the stomach. So that we've covered the mouth, and just in terms of making sure you keep an eye on what's going on in there. If there's a sore that doesn't heal, make sure you go in and have that checked out. Then we go down into the esophagus, and that is the pipe. We call it a food pipe rather than a windpipe, from the back of your throat down to the top of your stomach. So that runs through your entire chest area, the esophagus. You can get things like ulcers and what we call esophagitis, which is any itis is inflammation of the lining. So it's the inflammation of the lining of the esophagus. That usually can happen from things that are coming from the stomach. So your esophagus goes down to the diaphragm, which separates your chest from your abdomen. There's a little sphincter there, a hole where the tube passes through. If that sphincter doesn't work well, things from the stomach can reflux or go back up into your esophagus. And that's when you get what they call GERD, or GERD, where you have gastroesophageal reflux disease. So reflux, things coming from the stomach, refluxing back up into the esophagus, causing irritation and inflammation on the lining of the esophagus. And if that goes without being treated, you can actually get ulcers and bleed from them.
Now, let me ask you a question. You know, like in plumbing and you have pipes, is there a way to clean out your pipe going to your stomach?
No, we shouldn't be cleaning out anything.
Okay, so there's no, because somebody's, drink hot tea, ginger, open you up and clean out that area, but we don't have no plumbing cleanser things for you from your mouth to the stomach.
No, because actually the esophagus, the stomach, the intestine is actually a muscle on the outside. That's the whole way how we have peristaltic waves. So the muscle on the outside contracts and moves things down. That's how food can go down. If you have problems swallowing and have like food sticking, then we look down there with a scope called an endoscope, and we look down there to see if there's a narrowing, because there can be a narrowing from chronic irritation and inflammation where it starts swelling up. So the tube should be, say, 2-inch diameter, now it's 1 inch. What made it narrower? And why can't the steak that you didn't chew up properly pass through properly? So if you're having trouble with digesting food or making it pass through your esophagus, we have to look down there and see what's going on. So there isn't, if things pass through properly, it should go through there without any problems. The muscle moves it down there into the stomach. There is nothing to clean out. It should be a clean tube.
So let me ask you this question. I watch a lot of doctor shows and everything like that, and they said, you got a tuber. Where does that tube go if somebody has to be tubed with a breathing? Because it seemed like
when you put a tube down to get put on the ventilator. Okay, so the esophagus is the tube on the front side. That's your food pipe.
Okay.
Then you have a larynx, which is the air pipe going down to your lungs. So you have a trachea, and that actually is the tube that we put that's the airway that we put the tube down in order to put you on the ventilator or bag you. And that trachea goes down into your lungs.
Okay. So there's 2 tubes.
Yeah, there's 2 tubes.
Okay.
Yeah. So sometimes if we put and anytime they put a scope down, or if they put the scope down, they're going to go through the mouth. So they're going to get to the right place. But when you're passing the what we call a tube to go down into the airway, you have to have something that looks down, and then we have to listen before you start putting them on a ventilator. You have to listen to make sure you hear breath sounds on both sides, because you could have it down in the wrong tube.
Okay.
Yeah, so you have to pass it down the proper tube, get that tube into the airways, so now you can bag them and ventilate them, and the air is going into the lungs instead of the stomach and making the stomach go up and down.
And so that is why when you might drink water and they say it went down the wrong tube and you start coughing, that's the larynx and not the regular digestive
esophagus, right?
Okay.
So when it goes down the wrong pipe, you start coughing. Yes, and that's a good thing. It's a reflex to protect your airway. You don't want things, because there's such a thing called aspiration. So if you pass out or something and you have food in your stomach and it refluxes back up, it can actually go into your trachea and down into your larynx, and then you get aspiration pneumonia, because the food that was in your stomach went down into your your air pipe, and now down into your lungs. So there is aspiration pneumonia, and you're aspirating something, or you swallowed something that went down into your air pipe instead of your food pipe.
So is that why they say don't go to bed when you eat? Wait 2 or 3 hours before you go to bed so that it doesn't have it, because you're laying flat?
Yeah, it definitely. You want to digest your food, get it out the esophagus and the stomach area down into the small intestine, so you don't want to lay down right after you eat. And it's probably better for people that have reflux problems to sleep on the elevation of a bed. So elevate the bed or sleep on a wedge pillow or a couple pillows to just keep your head above your stomach area.
Now, I do want to let you know that I'm growing in my age area, and my wife was like saying, let's get one of those adjustable beds, right? Well, back in the day, we just called them hospital beds.
Yes.
But now everybody got these adjustable beds, and I refuse to get adjustable bed because I did not want to feel like I was getting older and everything else of that nature. But when I tell you that adjustable bed is a beautiful thing.
Yes.
Yes, Lord.
You need to be open to change, right?
Hey, and I sleep on an incline all the time. I sleep so good now.
Yes.
Because I get to adjust towards what's most comfortable. I don't have to stack no more pillows. Mm-hmm. And I said, so I just want to send a shout out to all the incline bed users. Don't call it hospital bed. Just call it that we upgraded.
Exactly. And they're not cheap either, but they're definitely worth it. Plus, they also heat and cool you too. So
Yeah.
when the women run hot at night from their menopause, they can have their mattress cool them down, and the spouse who's freezing out because the fans on is going on them, they can have their mattress heat them up. So it's a good thing.
Yeah, and the only thing that tickles me more than anything else is the vibration. It vibrates the whole room. I said, well, we won't be using this. It's too much vibration. But I talk about that because I think that what if people had adjustable beds at an earlier age when they start experiencing certain things and could make adjustments even in their sleep pattern.
Well, I would say, I mean, an adjustable bed is a good thing for people that have problems with like sleep apnea, obviously chronic reflux. But if you have a problem like that, you have to get to the source of it because then you can treat it, get rid of it, and then you don't have to actually rely on that issue. If they have something called a hiatal hernia, do you know what that is?
Yes.
Okay, so a hiatal hernia for the audience is where that, like I said, that sphincter or that little opening area that's in the diaphragm. It's the diaphragm's a very thin muscle that separates your abdomen from your chest area. When the hole that lets the food pipe go through there is a little too large, and you lay back or you wear tight clothes or you eat too much, part of the top part of your stomach can push up into the chest area or up into the lung area, and you can get a significant indigestion and things like that. You can have more reflux, a lot of discomfort in the upper abdominal area. So when people have hiatal hernias, we tell them to avoid wearing tight clothes around their waist so it doesn't push the stomach up into the chest area. Also to sleep on an incline. So for the patients like that, bed that inclines does help. And especially for chronic reflux patients. So there are needs for them, but for people that can't afford that investment, then a couple pillows or a wedge pillow or something will do the same trick. Yes.
Okay.
All right.
Okay, so now we done went from the mouth to
The esophagus.
the esophagus. We done found out about the trachea and the larynx, right?
Right.
And now we're at the stomach.
Right. So I do want to say, and when I talk about esophagitis and gastritis, I'm going to tell you some of the symptoms that it causes, but also the types of things that aggravate it. So esophagitis, the most common thing is reflux, the acid going back up into the esophagus and causing a burning irritation. You get down into the stomach, which is just past that sphincter, is gastritis. So the stomach is the itis of the stomach, so gastritis. And that is, I'm sure people know what the shape of it looks like, but it's a large enough sac that holds your food and allows the enzymes and things the good bacteria and everything to break down the food and start sending it into your small intestines. So it's still kind of liquefied. It breaks things down before it passes through the small intestine. But if you have a lot of acid, if you're an acid producer, or you eat foods that cause more acid production, like caffeine, alcohol, tobacco can cause irritation. There's, acidic food, spicy foods, greasy foods. Those things can cause irritation on the lining of your stomach and your esophagus. So you do have to be careful when someone comes in complaining about those symptoms. We ask them about their diet, and then we have to tell them to decrease these things. Caffeine. So if you can do coffee that's decaf, you run a better chance of not having irritation on the lining of your stomach.
Oh, Dr. Afflalo, you are working with me on this because I'm a coffee lover, and I went to the doctor. Said, Doc, I'm not feeling a certain way. I'm feeling got palpitations and everything else. And she said, okay, well let's check out everything. She said, well, everything looked good and everything. And as I was getting ready to walk out, she said, how many cups of coffee you drink a day?
Yeah.
And I said, on a good day or a bad day. She said, on a bad day. I said about 6 or 7.
Oh my God.
And she said, okay, we're going to limit you to 2 coffees a day, caffeinated, but you can drink all the decaf you want to drink. And so, I'm obedient. Some people say, oh, that don't make no. I'm obedient. I drop my coffee intake down to 2 cups a day, and sometimes I only have 1 cup. But I talked to my executive manager. I said, look, I need to find some good decaffeinated coffee. They went on a search and found me some good Colombian decaf coffee. I don't even miss the caffeinated coffee. And so, but I wanted to be obedient and to what my doctor had shared. And true enough, everything fell back into place.
Yeah.
I was good.
Yeah.
Now, my question, now that we're in the stomach area, and the stomach is a muscle,
As a
right?
muscle. Hmm.
So how do you, if you kind of stretched your stomach out over the years, eating rich foods and everything, so now you got a bigger, your muscle has expanded. How do you then help your stomach to contract as you then eat less food or put more in? Is that something that takes years? Does it never come back to that size of a fist? How do you help it contract or get back to normal? What kind? Can you eat certain foods or what?
No, it's about how much you eat. So
Okay.
when you keep stretching that muscle out, then what's going to happen is it's like when you work out, your muscle gets big, but when you stop working out, it starts flattening out, right?
Mm-hmm.
So if you don't want to have a large stomach, stop eating large meals.
Mm-hmm.
Go back down to multiple small meals, and your stomach will adapt to the point where now when you eat a large meal, it's like, oh, I feel really full fast. So you can train it to now have lower or smaller capacity, but it's all about discipline and how much food and quantity that you eat at a sitting.
Okay, so let me ask you a question. So say for instance, and this is something I think will really help people. Say for instance, somebody says most of the time your stomach should be no larger than your fist. Am I right? That's smaller?
Give or take, yeah.
Give or take. So if I only eat a fist worth of food, how often can I eat without stretching that stomach muscle out? Is it every 4 hours? Is it every 6 hours? If we're trying to train our body to get back to that smaller size in our stomach intake.
I mean, a lot of people do multiple small meals 2 to 4 hours. So it
2 to 4,
depends on
okay.
how much you eat and how the meal, it depends on the meal. If you eat protein, it'll last longer.
Yeah.
And some carbs will last longer. So people that are into fitness will eat multiple small meals with like a chicken breast and something, right?
Mm-hmm.
So I would say for the average person, no more than every 4 hours
Okay.
during the time that you're awake, right? Because otherwise you're going to overeat too, just by
Okay.
taking in too many calories. But if you eat smaller amounts, you have more protein involved, right amount of protein with a healthy fat, like a half of avocado or something like that, or a healthy grain, that can last you longer.
Okay. Okay, so for everybody that says I'm trying to get my stomach to shrink and everything else, multiple small meals, but that don't mean 10 times a day. That means every 4 to 6 hours so that you can get that and retrain your body. And that's the beautiful thing about the body is that you can retrain most of it, right?
Mm-hmm.
All right, so we're in the stomach.
Yes.
And I got to ask this question. Gastric bypass. That used to be a big, big thing before these different pills and all that come out. I won't talk about that. But why get gastric bypass if it's a muscle that can then expand again?
And that's part of the reason why some people aren't successful with weight loss.
Mm-hmm.
So you have to do several things besides the surgery. And it literally, gastric bypass means just that. They cut a piece of the stomach out and then they bypass a little bit of it. So, there's a sleeve and a sling and a band and all that where you just kind of cut down the size of it. But the point is that you start training that stomach, the smaller stomach, for smaller portions. Mm-hmm. And people do have problems when they stretch it too much. They start having a lot of vomiting. So
Mm-hmm.
people that have had gastric bypass have a lot of GI problems with vomiting and things like that because they're still having their old eating habits. That truly is multiple small meals there until you get to the point where you don't stretch the stomach and you don't have the complications or the side effects to it. I've had a lady that we had went through the whole trouble of gastric bypass. I think she lost 10 pounds because she kept eating, she was a postal worker, carrier, and she kept going to the McDonald's and eating fast foods and all that stuff. And so she never really did the discipline that it takes to be consistent with weight loss because it has been successful, but it's very radical. Now they're not doing as much of that because there's all these injections and pills and things. So, yeah.
The reason why I asked that is because of the fact that everybody I know who has gotten gastric bypass, the first thing that they said that they're told, and even I watched a show called My 600 Pound Person,
Mm-hmm.
and they literally will say, before we will do this surgery, you have to lose 80 pounds or 35 pounds or things of that nature. And here's my question. If you can lose 35 or 40 or 80 pounds to get it done, why don't you just keep on the journey? Instead of doing the drastic surgery, get down to the smaller portions. Because it's still going to give you the same. So here's my question. if you don't get your stomach cut down, you don't have gastric bypass, but you go with the same mentality of smaller meals as if your stomach was cut down, won't it have the same results?
It will if you eat the right foods. The
Okay.
people that are 600 pounds, if you watch that story, they're sitting in, they're laying in their bed with six hamburgers, 4 containers of fries. They have to eat. They have to change their eating habits, change their mindset, have to do a lot of mental health in terms of being able to visualize themselves small, because some people self-sabotage.
Yeah.
And so there's a lot of mental health involved with that. So it's not just small portions, it's a change in eating habits and avoiding the things that gave them the weight to begin with.
Yeah, because I am a chicken connoisseur. I love me some chicken. And so Super Bowl came around. I've been doing really good. I've been working out every day. Even when I had the flu, I was getting my workout in. I was not going to let my workout stop. So Super Bowl comes around, and that's chicken wing heaven, right? Salted pepper chicken wings, all these different wings, right? And so my wife said, "Well, what are we going to eat for Super Bowl food?" I said, "Let's do wings." And she said, "Okay." I said, "Pull out the air fryer." And I said, "I'm gonna season these wings up. We're gonna throw them in the air fryer, get the side real crispy and everything. We can toss it in whatever we want to toss it in, but instead of deep frying it, instead of going anywhere else, let's cook it ourselves." And the funny thing about it is, I actually enjoyed it more with literally with no sauce on or anything else. I still had the crunch, I still had the flavor, I had everything that I wanted, and it also was just saying to me, look at, you can still enjoy your foods, but you can choose how you prepare it differently.
Exactly. So by avoiding the oils, that really helps.
Yeah, and
Yeah.
even with, I'm a big fan of avocado toast, and before it used to be a little salt and pepper, right? Now it's non sodium based
Seasoning.
seasoning, and I'm still enjoying it just the same. And so I want the reason why I want to stop there is because so many people are on this weight thing, and they're using waist trainers and everything else. Can we talk about the waist trainers? Because it seems like the waist trainers could damage your organs.
I don't even know what a waist trainer is.
Well, they get it. It's like a girdle,
Okay.
but they call it a waist trainer, and you pull it really tight, and they wear it all day to try to make their waist and their midsection more defined. And there's some women that, you remember the corsets, that their waist trainer where they can pull it tighter and tighter every day, and it makes their waist smaller and smaller, but it's actually moving around, to me, bones.
Yeah. No, to me that's not healthy, because the organs that they're pushing inside the abdominal area is getting squished and pushed up, and then that would be a hiatal hernia issue. You're pushing the liver and the kidneys and all that stuff. That doesn't make sense, because it's not making you any smaller. You still have to lose the weight. So I don't understand why they would even do that. It's just a long process of exercising, eating properly, and slowly getting the waist to go down without, putting that corset on there.
Yeah. All right. So we're at the stomach.
We're
I
at
got
the
one
stomach.
More, one
Okay.
more question. How is it that these pills with Wegovy and all this other stuff is causing people that it was for diabetes, but it's causing people to lose weight, and now it's like the weight, the drug of choice to lose weight. Is there any fear factor that is going to really truly mess up their whole entire body eventually?
I don't know all the research behind it, but I don't think it's been out long enough to know 20 years, 30 years down the road what it can cause. I just know that most people, Americans anyway, or human beings in general, like a quick fix. So like I tell the patients, it didn't take you, it took you forever to get to this size. You can't expect to lose the weight overnight. Take your time, do it properly. If you develop good habits, you can stick with it longer. The problem with that is if you take injections and pills, and then after you lose that weight and then you stop it, after a while you go back to your old eating habits and you gain the weight back. So it's really about discipline and a lifestyle change is what makes it successful. Is you can do those things to help you get to a point, but if you haven't changed your mindset and how you respect food, and knowing that you eat food to live, and you don't live to eat. So if you can have your mindset in such that you're eating healthy, making good choices, air frying instead of deep frying and things like that, taking skin off of chicken when you can. It's hard to take it off of wings. But if you're going to do, another type of chicken, take the skin off because it's nothing but bad fat. Make those choices and stick with it for life. It doesn't mean on occasion you can't have a slice of pizza or on occasion you have something else. But your main staple should be good, healthy choices.
Yes, and I want to say this shout out to OG's. OG's is the only place that I actually felt like I actually had a real vegetarian pizza, whereas there was more vegetables on there than anything else. Even the cheese was light compared to everything else. But OG's does a wonderful, wonderful job on a vegetarian
Okay.
pizza. I give it thumbs up as the best vegetarian pizza in the city. With that being said, let me ask this question. We're in the stomach still. Let's talk about antacids and Pepsid and all the stuff that people take for heartburn. What are the effects on that stomach when you're taking multiple antacids or Pepsid or things of that nature?
So there are the once again we're talking about gastritis, so irritation of the lining of the stomach. One way of doing that is getting rid of the things that cause it. Stop smoking, stop drinking alcohol, stop doing the caffeine, stop the spicy, greasy, acidic foods. Acidic foods like tomatoes, oranges, grapefruits, things like that is very hard on the lining of the stomach when it's irritated. It doesn't mean that you can't have it, but when it's irritated, it's like a raw sore, and you're not going to heal it if you keep, irritating it. So the antacids, depending on which one, you can take a liquid one like a Riopan or a Maalox, Mylanta. It coats the stomach and tries to prevent anything else coming down from irritating that until it's healed. The H2 blockers or the Zantac and things like that, Zantac and ranitidine and omeprazole and Pepsid, and there's a million and one of them, they tend to block the acid production so that you have less irritation on the lining. So it kind of prevents further irritation on the lining of the stomach. And that's good for temporary, but you don't want to like take that and then eat bad. Because then you know what I mean? So it's a temporary thing to heal like ulcerated areas. When you have a point where your gastritis is so bad, it's now created an ulcer on the lining of your stomach that can bleed. It can cause significant abdominal pain. So you want to heal that, but there's no way to heal it other than resting your stomach. You can't stop eating. So you protect the lining with these medications. It should be temporary as you learn to eat healthy and avoid the foods temporarily, at least for the several weeks or whatever, a couple months that you need to heal that ulcer. And then you can go back to avoiding that medication and eating healthy.
Yes. Now I asked Dr. Afflalo about vitamins and things of that nature, and she said, "Oh yes, you need a vitamin in your life." I said, "Okay." So I do my research on finding a good multi, what is it called? A
Multivitamin?
yeah, multivitamin for men over 50. Yeah, praise the Lord. But let me ask you this question. Is there a way, and we're back in the stomach, that we could eat or take vitamins or something that gives the best formula in the acid in our stomach to do the best digestion?
I don't know if there's any actual vitamins for that because your stomach has, bacteria in it that helps to digest things. So there's healthy bacteria and there's some bad ones that will cause ulceration, like H. pylori causes ulcers in the stomach and can cause gastritis. So I'm not familiar with any actual vitamins that can do that. It's really all about whatever you bring down there, how it's going to break down and affect the lining of your stomach. So, you don't want to keep pouring like alcohol on a wound, because it'll just keep burning, or some kind of acid on the wound. You want to, pour water on it or something soothing until it heals up. So the lining is very temperamental. You can have significant bleeding, and if you're bleeding from the stomach significantly, you will have black stools. So when people start having a black stool for no reason, and that's what they either throw up something that like black stuff, or they have black stools for no reason, and they haven't had a stomach ache and taken Pepto-Bismol, because if you take Pepto-Bismol for an upset stomach, it will turn your stools black. But if you have not had that and your stools are black, we're concerned about you bleeding in your stomach mixing with the acid, so we have to scope you and look at that.
Okay. So here's my last question. Probiotics. People are telling folks to eat yogurt, get Activia. Now, is probiotics for the stomach or for the intestine?
Well, I mean, it's a continual track. So it's going to help the stomach, and as it passes through, it's going to help the intestine. So it is kind of a balance of the bacteria that you need in there, the lactobacillus and all the other things. There's millions of those lactobacillus that you need to kind of help the lining of your stomach. So it is a good thing. Some people do eat, they'll take the tablets or the pills, the capsules, or they will eat some yogurt.
Okay. Well, I think I've asked all the questions of the stomach. Where are we going next?
Well, I wanted to tell you a little bit about what the gastritis and some of the causes of gastritis, not only just food, but like I mentioned, a lot of times it's bacterial. So H. pylori is a particular bacteria. And when we can't seem to get control of the the gastritis, we'll go down the scope and take a biopsy. And if it says H. pylori, or sometimes we'll actually do it by a specific test, then we have to treat it with antibiotics, and that's how it gets better. There's NSAIDs, so non-steroidal anti-inflammatories like Motrin, Advil, Aleve, those types of things. If you take too much of it on an empty stomach, it can cause gastritis because it can cause inflammation. So we have to be careful when we're treating our arthritis pains or our back pains and things like that, not to take too much of the non-steroidal or the NSAIDs without having some kind of coating on the stomach, which is food. Excessive alcohol consumption will definitely cause irritation in the lining of the esophagus and the stomach. Chronic stress produces all kinds of things, and that definitely can cause stomach problems. And then other things, I mean, when you're vomiting from some other condition and you start vomiting up bile that comes from your gallbladder and stuff like that, that can cause significant burning in the stomach and the esophagus. So there's a lot of things, food allergies and stuff, but just know that it's not a one type thing. Most of the time it's food that causes the generic gastritis, but there's so many other things.
Now, I'm hearing everything, but you hit one thing, and I want to just ask the question, what is stress? Because, everybody says, oh, you look stressed, or you must be stressed. But what is stress, and how does it medically show itself?
It really depends on the person. Stress, we all live with stress. I mean, life is stressful, right? Your job, your, driving in the car, the government, that we won't even go into that. But it really just depends on how people manage their stress. So if you compartmentalize it and just know that it's out there, and if there's absolutely nothing you can do about it, then you don't let it, you try not to worry and stress about it. Pray about it if you need to, and then come back and do what you need to do. But if you internalize everything and worry about every little thing, it creates a lot of hormones and things like that that just causes all kinds of physical problems. Headaches, neck pain, back pain, physical things from stress. And obviously causes a lot of mental health issues, depression, anxiety. It all comes together. So if we don't know how to manage our stress, and that's everything. You have kids that you're raising, you're worried about them, or they're giving you trouble. You're in school, that's stressful, you're at work. Life is stressful. But some people can handle it well. They deal with meditation. They don't internalize it. If they have control over it, they do something about it. And when they don't have any control about it, as I tell my patients, if you can do something about it, get on with the program of doing something, correct the problem so that it stops causing the stress. But if you have absolutely no control over it, I'm like, let go and let God.
Yeah.
Because it doesn't make sense to physically affect yourself by worrying about something that you have no control over.
Exactly. And when people say, oh, well, you're stressed and you're this and you're that, sometimes a lot of us as African Americans, we kind of thrive off of, the stress, and it actually motivates us.
Yeah.
So all stress I don't think is bad.
No, and we've learned how to adapt to it because our whole culture from our generations have had to deal with stress. You can't go through slavery without being stressed, right? Yeah. And being beaten and all that. So we have acclimated to stress and can handle it better than most other, ethnic groups. So stress, if you learn how to handle it and don't let it affect you, then you can actually go through life without having all of the symptoms the physical symptoms that come with, and the emotional and mental symptoms that come with stress.
Okay. All right. You said that, so I had to ask the question.
Absolutely.
So where are we going next?
We're going to go down to, travel down to the small intestines.
Okay.
And so in the small intestines, food is still somewhat liquidy. It's been broken down with all the enzymes and things. It's still liquidy passing through. Remember the muscles on the outside, the lining on the inside? So the peristaltic waves are the waves of the food moving through the small intestines. And then you get to the large intestine. So if it's liquid, while it's going through the small intestine, there's the mechanical piece of it is to pull fluid out of it, pull water out of it, so it starts forming. So by the time you get to the larger intestine, it starts becoming more solid.
So let me ask you a question. When does the food that you eat, do the body use it to pull nutrients? Where does the nutrients be pulled? Is it in the stomach or is it in the small intestine?
It's going to be along the whole way.
Okay.
So as you're breaking down food and storing it in places, into the cells for energy, as you break it down, it needs to be stored. But some of the waste is what goes through. So it travels, it pulls out what it needs. The rest of the waste usually goes through. Now, if it's traveling too fast, like diarrhea, and you don't have a chance to do what your body doesn't have a chance to do what it's supposed to do by pulling out the nutrients, then that's how you can get, I thought this was off. I'm sorry. So it is off. How does that go on when it's off? Sorry about that, audience. But but so it does. The process is the lining of the mucosa is what does the work as the food gets processed.
Okay.
Gets processed.
So my question is, so say for instance, by the time it gets to the small intestines, is the small intestine still pulling out nutrients, or is it this processing it to come out?
It's still pulling out nutrients and the liquid form, the
Okay.
water part of it. And so they can start becoming more solid as it gets into the large intestines, where by the end it's a formed stool with the waste, mostly waste.
Okay. Okay. So we went through the small intestines. It's mostly liquid, and then we go to the big intestine. Now let's just be real. How long could your intestines really be? I've heard 9 feet. I've heard all kind of things. How long really are the intestines?
It's long. I don't know exactly how many
Okay.
feet because I think it's a little bit different depending on the person, but on average, yeah, it's long.
Oh, okay.
Yeah, you can pull it out for a long time. That's why when you look in the pictures, you see it going back and forth like this for small intestine. The large intestine goes, so if you look at a picture, the large intestine goes from let's say from the small intestine, it starts off on the right side down at the bottom. That's where the small intestine ends and the large intestine starts, and that's where your appendix is, on the right lower side. Then you get the ascending colon going up the side, your right side, the transverse colon going across, and then going down on the left-hand side is the descending colon down into the sigmoid colon. So it's like one big, almost like a square, where you start off on the right side. The appendix is the end, like between the small intestine and large intestine. So if something gets stuck in there, you get appendicitis, right? But that's where your large intestine is. It's just one big, like, 3/4 square.
So you mean to tell me for it to get to the end of the thing, it got to go back up and around and then down?
Yeah, it has to go up. You have the picture there. It goes up, it goes across, it goes up on the right side, goes across the upper part of your stomach, and then it goes down on the left side, and then it goes out through the sigmoid into the rectum.
Okay, so I'm gonna ask this question because these are old community things. They say when you're constipated and you want your bowels to move, they said sit in a praying position with your butt up in the air and your chest down lower to the ground. And is that because it need to adjust that way? And then they tell you stand up or lean to the side. Are they trying to guide it to the way? I'm just trying to understand.
I have never heard of that.
Really?
And I don't think any kind of positions are going to help anything. I think you need to get some stuff going through there to move it through.
Okay.
Drink some more water because maybe you're dehydrated. People don't drink enough water, and that's what you need to push things through. You need more fiber in your diet to push things through. So if you're constipated, things in there are very dry. So fiber, water, that's what we tell you to do. And then if all else fails, we tell you to take, a stool softener or a Miralax or something to just move it through, or an enema from the other end to loosen things up to get them out. We do have to disimpact people sometimes when their stool is too large, too firm, too bulky, and we have to go in there and start the process by getting that large bulk out of the rectum so that the rest of it can pass. Not a pretty picture.
So the whole definition of full of stuff.
Yeah, is real.
Okay. So one of the things is, so how do we keep a healthy GI tract so that we have good flow?
Water and fiber.
Okay.
And if you don't do, you can do green leafy veggies. You can do anything that's going to, any fiber. You can do bran cereal. You can do bran muffins. Anything that's got some fiber in it is going to help you move your bowels. And then water is always the key.
Okay.
Yeah.
So water. So on average, how much water should we drink a day?
6 to 8 glasses. And
8
unless
ounces?
6 to 8 ounce glasses, yes.
Okay.
6 to 8 ounce glasses.
Okay.
If you're working out more and getting rid of more through sweat, you might have to do a little bit more.
Okay.
Yeah.
And you will know that you're drinking enough water because you have easy stool passes?
Fiber and water, yeah. That you can actually have a formed stool that's not difficult to pass.
Okay. And what is fiber? Because some people think like, okay, I need to eat oatmeal every morning. Is that fiber? Or, for me, I heard an apple a day keeps the doctor away. And so I have my apple every day. What is the best source of fiber that is a guarantee besides, what is it, Metamucil or whatever?
Metamucil. Yeah. Um, yeah, it's better in your diet. So, like I said, green leafies, anything, salads, greens, things like that, spinach. Definitely oatmeal. There's a lot of different forms, but fruits definitely. I mean, you think about the pulp and stuff in your oranges, definitely the skin on the apple. That's why it's better to eat the fruit than to drink the juice, because the juice is full of sugar. When you buy juice, apple juice, orange juice is full of sugar. You eat the apple, the juice has several apples in it plus other stuff. The apple has lots of fiber with less sugar, meaning that's natural sugar versus some added sugar in your juice.
Okay. So are we at the end of the GI tract? Because, I got questions about the GI tract, because I want to talk about hemorrhoids and all the other stuff.
Well, we're not quite there yet. So we're in the colon,
Okay.
and remember I told you itis. So now we have inflammation of the colon, colitis.
Okay.
And there's several issues. Some people have inflammatory bowel disease. That's inflammation of the colon, or Crohn's disease or ulcerative colitis. Those are inflammation of the colon lining. So we had inflammation in the esophagus, esophagitis, gastritis. Now we have colonitis, or colitis, sorry. So inflammation of the colon can lead to diarrhea, abdominal pain, bloating, gas, rectal bleeding, loss of appetite. And then when you have something like ulcerative colitis, you can have bloody stools. I mean, just you think you're going to the bathroom to have a stool, and it's all blood, because there's so much inflammation in the lining that you're sloughing off lining with blood. It's really bleed. And you have to have steroids and all kinds of special medicines for those particular patients to stop the bleeding from the colon lining.
Okay, so help me out. Where is the colon in reference to the large intestines?
So on that picture, what I said, the tract that goes up, across, and down, that's all the colon.
Okay.
So everything, all the little stuff in between, when you look at a picture and all the smaller bowels that's going side to side, that's all the small intestine.
Okay.
The large one's strictly just an up, across, down, and out.
Okay. And the colon, and that's all considered colon?
That's all the colon.
So the large intestines is the
colon. Absolutely.
Okay.
Yeah.
Okay.
And then the last little piece, that little sigmoid, is the last piece before you get to the rectum, which is the going out to the cruel world.
So since we're at the colon, can we talk about a colonoscopy?
Yes.
And do they go all the way into the small intestines, or they only do the large intestines?
So there's two types of scope coming from the rectal area. There's a flexible sigmoidoscopy. That's a shorter scope. When I say shorter, it's like probably 60 centimeters. It goes up your sigmoid, around up the left side of your colon. Okay, that's the descending colon. So you'll get that part, your left side. It doesn't do the whole colon. That's your flexible sigmoidoscopy. We don't do that much now, because there's problems on the right side that we need to see. So a colonoscopy is about 120 centimeters. It goes the entire colon, up the left, across the top, down the right, to the appendix. So it goes the whole, and then you can see everything inside, polyps, ulcerations, anything in there. And that's what you need at least the age of 45. That's the screening part. You need to start screening. We used to screen at 50. We're asking people to start screening at 45. Bozeman died at 34 of colon cancer. So for people in the family, and like I think I mentioned before, my brother died at 39 of colon cancer. So he got it at 35. We don't even screen at that point.
Yeah.
So family members need to start screening at least 10 years prior to the affected family member. So if you have someone in the family that has colon cancer, you should start screening early. You don't wait until 45.
Yeah.
Yeah. And then that requires a colonoscopy.
Okay. All right. So what is the whole thing about polyps, and what are polyps, and why are polyps there, and did I eat wrong? How do polyps get there?
They just grow. So it almost look like it can be a little bit like something stuck, like a mushroom cup on like a top of a mushroom on the inside of your colon, or it can be like a little bit of a stalk, like a little broccoli stalk. So polyps grow off of the internal mucosa, and we need to test those, biopsy them to make sure they're not cancers or precancers. That's the whole reason for doing a colonoscopy. You can't see that any other way but visually through the scope with the camera at the end, and it has a sneer that can go out and just biopsy those little things that look like they're stuck on the wall, like I said, a mushroom cap or growths. Anything that's in there Anything growing in there should not be there. It should be a nice smooth. It should look like the inside of your mouth, smooth, pink, and it has ridges because that's the way how the colon looks with the sphincters. But anything growing in there should be biopsied. And if you have polyps, they don't mean they're necessarily dangerous, but they need to be biopsied. So if there's any precancers, we can get to it early. And if it's cancer, we can cut that part out immediately and still live.
Okay.
Yeah.
All right. So where are we at now?
We're at the severe end. So I will just say that some people have Crohn's disease, and that's pretty severe. So between ulcerative colitis and Crohn's disease, all in the colon, is a significant inflammation. Those people require medications because they can't go anywhere. They can have bloody stools, and anything can set them off. Any food or anything can set them off. So they need to be on medications to control that. And you'll know that if you start having bloody stools for no reason, you get that evaluated. They biopsy some areas, they can diagnose that, and then they put you on you're followed by a gastroenterologist, and they follow you for that and treat you.
Now, I'm just going to ask a question because you've been in the medical field for quite some time. When did we start making commercials look so romantic and so sexy? I saw a commercial the other day about Crohn's disease, and it looked like she was going on a trip and that she was living her best life. And I'm like sitting up here, Crohn's disease. When did we start making commercials look so friendly? And then at the end, they got this little thing. This may cause death, heart attacks, and everything else. And they changed the voice as if you're not going to, pay attention to that.
Yeah.
Is that deceptive?
Well, of course it is. Subliminal message.
Yeah.
The point is, people that have these conditions, you're not going to pay much attention to it because Crohn's disease is what to you? Nothing. Mm-hmm. But for people that live with Crohn's disease, they need to know that there is life outside of Crohn's disease. So there is a medication that they can discuss with their doctor to say, I want to live that best life that they're showing on TV. And so it's promotional, it's marketing, but there is opportunity to let people know they don't have to live inside their house next to the toilet because their Crohn's disease is not controlled.
Okay, I can receive that.
Okay.
I wish they would have had that for when I got the flu.
Oh,
take Tamiflu.
Yeah.
It'll be okay.
Tamiflu helps, but it doesn't get rid of everything.
Exactly.
It definitely shortens the course of your flu. But yeah, the struggle's real with flu, and it's out there.
Yeah. Now, my question is, since we're talking about the Mucinex, what does Mucinex really do if you have, stuff coming here, stuff coming there? What does Mucinex really do? Or is it just a gimmick?
No, it's not a gimmick. I live by Mucinex.
Okay.
Yeah. Mucinex is a mucolytic agent. It breaks down the mucus. So when your sinuses are stuffed with mucus and you can't breathe, or you've got a lot of mucus in your chest and you're coughing up and you just feel congested in there, it helps to just break that down, loosen up, and allow you to move it through.
Okay.
Move it through blow it through your sinuses, cough it up. So it does work well. I swear by it for my allergies. When I get stuffy, I take one of those, I'm fine.
Yeah. And with this whole thing, I was blessed with a Nervage.
Oh, yeah.
And me and Nervage, we got a thing going on now.
A romantic relationship.
Dr. Afflalo, I'm on a weekly regimen. Even if I'm feeling good, I'm like, okay, this week we're going to flush out again just to make sure ain't nothing getting up in there. Because, I've been battling allergies for years. And so shout out to Nervage. The neti pot didn't work for me every time I felt like I was drowning, but Nervage, yeah.
Well, you can do that regularly, and if you suffer from allergies, the best thing to do is do it on a routine basis, whether it's every few days or once a week or every day, because what it does is flushes out anything in there, the impurities plus things that pollens or allergens that go up in there that we breathe starts causing an histamine reaction.
Yeah.
And so, in order to prevent that, you get rid of the allergens, or the things that are in there causing the allergic reaction.
Yeah. Okay. So where are we at? Because everywhere you go, I got questions.
Okay, we're about to come out. So we're at the sigmoid colon and the rectum. That's where at the rectum, you can have, like I said, bleeding from the rectum. That's going to be bright red blood. Like I said, if you have black stools or black blood coming out, it's going to come from the GI tract up, where the acid is mixing with the blood. So it's going to be more of an ulcer in your stomach. If you have bright red blood, it's most likely local. External hemorrhoids, internal hemorrhoids. Hemorrhoids are just veins. They're large veins that are swollen, and then when a hard stool passes through, it pops and you start bleeding, or you wipe too much or whatever, or you have too much diarrhea and there's too much activity down there. So normally everyone has those veins, but when they start getting swollen, they get in the way, and they can come up like little cherries. On the outside, people have hemorrhoids hanging on the outside. They probably should be banded if they continue to bleed. There's suppositories you can put inside there, but really you can avoid having the hemorrhoids if you stop straining and pushing and allow your stools to come out formed but soft in form, and then you don't run the risk of making those veins swell up and get to the point where a hard stool scrapes it and it starts bleeding.
So explain to me, how do they fix hemorrhoids? Because I used to hear stuff about, well, they used to have like hemorrhoid cream, and somebody said, oh, they had the hemorrhoids removed, and how does that all work?
Okay, so the external hemorrhoids, you can actually do what they call a sitz bath, sit in a warm tub of water, just like how the moms that just delivered babies do a sitz bath to kind of heal that whole area. If you do that with warm water and Epsom salt, those things can actually shrink down if you prevent the hard stools from coming through and aggravating it and constantly wiping. That's why I think where they developed those wet wipes or something that you can flush. So you can do sitz bath and hemorrhoidal cream to hopefully shrink them down when they're small. If they get large, they need to be banded. So you literally put a rubber band around them and strangulate them, and then they drop off. That's a little uncomfortable. Then when you go inside the lower part of the rectum, so those are external, you can see them or feel them on the outside. Just inside, where you can look at them with what we call an anoscope, it's about this big, about 4 inches, 5 inches large. You can put it as clear. You can look inside and see internal hemorrhoids swollen. You can actually do a suppository, like the same hemorrhoidal cream is in a suppository. You put that in there and allow that to stay, and it has some steroid in it to help shrink down those hemorrhoids, preventing hard stools from coming down. So you'll still have to work on your stool, fiber and water. But then you can heal the hemorrhoids that way, or if they're too large and still keep bleeding, you have to go in there and band those.
Okay. All right. Now I'm gonna ask you. We went from the inner to the exit. Mm-hmm. My question is, for those people that have things entering through their exit, what type of damage or things happen when you have things coming the wrong way? Mm-hmm.
Well, there is a sphincter at your anus. That's what controls you. You can stop your stool from coming out, whatever. It's a sphincter, it's a muscle down there. When you put things inside the rectal area that starts stretching out your sphincter, you start losing control of your bowels. So if they get soft, you can't hold it till you get to a bathroom. You can't sphincter and tighten it up. You start losing sphincter control. And I can tell when I do an exam, a rectal exam on somebody, if they've had things going inside instead of coming out, because their sphincter is lax, is loose.
Okay.
Yeah.
All right. And these are all, again, very important things to know, that there are consequences for everything that we do. If we don't drink enough water, if we don't drink enough fiber, if things go in the wrong way, or in places that are supposed to be out, if it goes in, there's damage that can be caused. So my question, if your sphincter gets damaged, is there a way to tighten it back up or fix it, or you just stuck?
Well, we wouldn't necessarily go in and fix a sphincter, a rectal sphincter, if you're going to keep abusing the area.
Okay.
But you can certainly bulk your stools up to prevent having loose stools. Maybe the proctologists do that. I'm not sure about that. I know we do help, tighten up other things. We'll tighten up the sphincter up here between the diaphragm to help prevent hiatal hernias. We'll tighten that sphincter, but we're not necessarily tightening up other sphincters where you may go back and still abuse it. Plus, if you put things in the rectal area, you can cause abrasions and cuts and infections and things there's all kinds of consequences for putting things in the mucosal lining that's narrowed, and you can also have lots of bleeding and stuff.
So here's my last question. Now we talked about, now we're on the outside. Tissue. What is the best tissue? Should we all be using wet wipes? Should we all have a bidet? What's the best way of cleaning that area without causing more damage? Is it Charmin? Do you have to use Huggy? What do you recommend, and how do you clean that area?
Well, obviously for the women, especially front to back, because if you do a back to front wipe, you're introducing bacteria from the rectal area into the vaginal area and bladder, or the opening of the bladder, urethra. You'll get lots of bladder infections. So front to back for wiping. A nice soft tissue so that you're not causing micro abrasions when you wipe. You can certainly use those flushable cottonelles or whatever they call them. That's fine. You just want to clean the area, and you wipe a couple times till you don't see anything on the tissue. Because if you leave that there, the bacteria sits there and can go into places and cause other spaces, vaginal, bladder area, and cause infections.
Now, let me ask this question. Some people say that countries that use bidets have a healthier rectal area than those that don't. Is that true, or is that just their belief system?
I'm not sure if it's true, but I know that the water flushing to the area does help to rinse out a lot of the bacteria off of the area. And then I'm assuming they have some white, unless they have a bidet that actually shoots up some
Air?
no, not just air, water, but like something that has soap to it. But yeah, I mean, it flushes the area and rinses it off like you would be in your shower, just putting the head of the shower head to the area. So it is good. You just have to wipe and make sure that the area is still clean.
Right. Well, I feel like I've gotten a real understanding of the GI tract. Is there anything else you would like to ask? And I haven't seen anybody say anything other than they like sugar too. They got to do better. Some people say, "Oh my God," somebody said, "Lord, help me to eat better." These are all things that came up. Somebody said, "Yes, this is great information." And this. I'm a sugar lover. Everything else. So I think we're asking a lot of questions. Any final statements? And I also need you to talk about what's coming up.
Yeah, I would just say the final statement is learning how to eat healthy. Lots of water, fiber, a balanced diet, your proteins, your healthy starches, avoid the white stuff and go with grains like quinoa or brown rice or something. Eat healthy. And like I said, the brown rice and things like that is fiber too. That'll help with your bowels. Mm-hmm. If your bowels are saying something, constipated or diarrhea, you need to go back and evaluate what you're eating and correct that problem. So that's the best thing. Stay active, exercise, and then eat a healthy diet. Those are the two things. Avoid, all the itises, avoid alcohol and tobacco and foods that irritate the lining of your GI tract.
Thank you for not singling out coffee,
Yeah, coffee, but caffeine is really it. Because, tea, too, has caffeine, so it's more caffeine than the coffee. And then I will just say as my final half a minute is that, of course, we have our health fair coming up next week, Wednesday, on March 5th from 10 to 3. It's obviously at the Jackie Robinson YMCA. That's our new home, has been for 3+ years. Our focus is Colon Cancer Awareness Month for March. And so we do want to let people know that's the reason why I'm talking about that this month on the podcast, and that still come out and get your routine health screening, your blood pressure, diabetes, cholesterol. We do have a new mobile van there, actually two, but a new one, Shiley Eye Mobile, free eye exams and glasses. Okay. So they can come out for that and
free eye exam and free glasses.
Yeah.
Well, all right.
Yeah,
okay.
Yeah. So that's our new gig out there, and of course, San Ysidro Health is still providing vaccines, COVID, flu, and Tdap, tetanus booster. So coming out and get stuff. We're hoping to get the mammogram van soon. UCSD has a mammogram van. We're hoping to do the red ribbon cutting. It was supposed to be February, and then March. Maybe it's going to be April. We're soon going to get a mammogram van out there.
Okay, so we do have a question. It says, "What type of feeling do you get when you have a blood clot inside your body?"
It depends on where in the body.
Okay.
I mean, if it's in the heart, you can have a heart attack. If it's in the brain, you have a stroke. If it's in the leg, you have like in the calf, that's a DVT, deep vein thrombosis. You have a swollen, painful calf that can travel up into your lungs. If you get a pulmonary emboli, you're going to have problems breathing and or die.
Okay.
So it depends on where the clot is.
All right. So, and if you think you have a clot, you should immediately do what?
Go get some help. Go to the emergency room.
Go to the emergency room. Well, I want to say thank you so much, Dr. Afflalo. I asked you to do this show, and I asked for this once a month, and you are not disappointing today. I felt like we got a full education. That's why we say, ask Dr. Afflalo. This is not a consultation. This is just good information. But always go and see your doctor for yourself. And remember this. If you don't know, if you don't feel, go ask somebody, especially the professionals. Well, final words?
No, just have a wonderful evening. See you next Wednesday at the health fair.
Well, all right. Y'all planning. They got free glasses, too. Free eye exam. Y'all better go out and check that out.
And free food, of course.
And free
produce,
food.
The produce.
And produce. And I want to say thank you for the home delivery produce. They got some good stuff in that bag.
Our local farmers are excellent.
Yes. Y'all have a wonderful evening. Y'all be blessed.